everyone, and welcome to today's lesson on heart failure exacerbations, specifically, what to do when they come into the ED. Now, most heart failure exacerbations are due to chronic heart failure. It's rare, not impossible, but rare for a patient to come in an acute heart failure who hasn't had some signs of it prior. Now, that being said, if these patients do present to us, they're usually going to require some quick thinking and immediate interventions on our part. So, when we assess these patients, one of the first things we want to try to figure out is why the exacerbation is occurring. Is it related to a comorbidity like acute coronary syndrome, where basically the blood supply is being cut off from the coronary circulation? Is it related to uncontrolled hypertension? Are cardiomyopathies the problem, which is preventing, pumping of the blood out of the heart to where it needs to go? Are the valves malfunctioning, which is basically causing backflow? Is it a cardiac infection, which could cause arrhythmias that are then going to alter the way the heart pumps? Or is it, and trust me, I see this one the most, is the patient non-compliant with their meds or their diet? I'll tell you, it's amazing what a little Chinese food can do to grandma's heart. You guys have any idea how much sodium is in that stuff? Jeez. Now, from looking at our patient, we can usually determine if this is right-sided or left-sided heart failure. Now, if you guys want, there are some really good lectures about heart failure on nrsng.com in the MedSurg cardiac units. So if you want some more in-depth info on heart failure, please go check those out. We're just talking about the ER today. Now, if we see things like swelling in the legs and the feet, that jugular venous distension, the ascites, that swelling in the belly, they can also have some nausea, which is basically caused by it's that venous congestion in the abdomen backing up, which is going to cause the nausea. All those things kind of lead to right-sided heart failure, right? If we're thinking about left-sided heart failure, this is more lung-based, so they're going to be short of breath. They're going to have dyspnea. When we auscultate the lungs, we're going to hear those crackles. You can't miss it. It's a little harder to assess that S3 heart sound, but any good ER nurse can pick up the crackles about as easily as they can pick up a pen off the desk. And these sounds are all related to the fluid that is building up in the lungs, that pulmonary edema. Now, when we go to treat these patients, remember it's the ED. So, what's always first? ABCs, guys. To that end, we got to help them breathe. So let's get on some supplemental oxygen. Probably start with an on-rebreather. You're going to want to get IV access, and I'll tell you why in a sec. We might want to use our BiPAP machines, and that's going to help to literally push the fluid out of the lungs with positive pressure ventilation. This is often done if we're kind of debating whether we want to intubate the patient. And in fact, BiPAP can actually keep us from needing that step at all. So we've put the IV in, right? Now it's time for IV meds. What we want to do is